Hi everyone and welcome to this 6-part educational series. Today we'll be covering oral hygiene instructions. To watch all of the videos before they're released on our channel, make sure to download the My Dental Care app from either the Apple Store or the Google Play Store. Let's get started.
In this video, we'll be covering a variety of topics to do with your oral hygiene.
The aim of toothbrushing is to remove the soft dental plaque, which is basically bacteria in your mouth, and food particles from your teeth to massage fluoride from your toothpaste over the surfaces of your teeth. The small concentration of fluoride found in your toothpaste is very good at strengthening tooth enamel, which will help prevent tooth decay. Toothbrushing aims to significantly help prevent the two main diseases in dentistry, gum disease and tooth decay.
So the first thing you want to do while brushing your teeth is to pay attention. This sounds simple enough, however it's so easy to switch into autopilot mode, and you may find that there are always certain areas that you're missing consistently with your toothbrush. Over time, this can lead to dental problems.
Dental plaque or bacteria builds up on your teeth and gums, so it's important to place your toothbrush at a 45-degree angle towards the gum line to ensure the removal of plaque, and the bristles must contact both the teeth and the gums.
So what you want to be doing is using gentle, small, circular motions on about 2 to 3 teeth at a time. Don't use excessive pressure or large back and forth motions like you see on many TV shows. This will usually result in brushing too hard, causing your gums to recede or lead to tooth wear.
Make sure you brush the outer, inner, and biting surfaces of each tooth. Remember, bacteria can't tell the difference between your beautiful smile and the areas people can't see, so clean all the surfaces equally. You should clean the back surfaces of your front teeth by tilting the toothbrush vertically and use gentle up and down strokes.
Ideally, you should be brushing for at least 2 minutes twice a day, and one time needs to be just before going to sleep, because you need to remove any food that may be left and stuck in between your teeth. Try to set a routine that you follow each time. It may help to divide your teeth into 4 quadrants, and always start on the same quadrant, for example, your upper right hand side. You should ideally be spending 2 to 3 seconds on each tooth surface.
You shouldn't rinse your mouth out with water or mouthwash after you brush your teeth. Spit out the foam and leave the toothpaste inside your mouth. The fluoride in your toothpaste can strengthen your enamel and help to prevent tooth decay.
You should be using either a soft or medium toughness toothbrush. Try to avoid hard bristles or brushes, as they tend to lead to tooth wear. You will usually require a small to medium sized toothbrush head, and try to avoid large sizes.
The key here is not to use it like a manual toothbrush. Let the toothbrush do the work. Just hold the oscillating toothbrush head for about 5 seconds on each tooth, making sure to cover all the surfaces before moving on to the next tooth. Regardless of what type of toothbrush you have, it's important to place your toothbrush at a 45-degree angle towards the gum line to ensure the removal of plaque, and the bristles must contact both the teeth and the gums.
Don't use excessive pressure or large back and forth motions like you see on many TV shows. This will usually result in brushing too hard, causing your gums to recede or lead to tooth wear.
Make sure you brush the outer, inner, and biting surfaces of each tooth. Remember, bacteria can't tell the difference between your beautiful smile and the areas people can't see, so clean all the surfaces equally.
Ideally, you should be brushing for at least 2 minutes twice a day, and one time needs to be just before going to sleep, because you need to remove any food that may be left and stuck in between your teeth. Try to set a routine that you follow each time. It may help to divide your teeth into 4 quadrants, and always start on the same quadrant, for example, your upper right hand side. You should ideally be spending 2 to 3 seconds on each tooth surface.
You shouldn't rinse your mouth out with water or mouthwash after you brush your teeth. Spit out the foam and leave the toothpaste inside your mouth. The fluoride in your toothpaste can strengthen your enamel and help to prevent tooth decay.
You should be using either a soft or medium toughness toothbrush. Try to avoid hard bristles or brushes, as they tend to lead to tooth wear. You will usually require a small to medium sized toothbrush head, and try to avoid large sizes. An electric toothbrush is much more effective at removing dental plaque than a manual brush. The bristles of an electric toothbrush change in directions multiple times at a high frequency, which makes it more effective at removing dental plaque. Certain electric brushes even have pressure sensors to ensure that you are not applying too much force, and this can help prevent abrasive tooth wear.
Despite this, you can still maintain a high level of oral hygiene using either type of brush. You just need to make sure that you are using good brushing technique and spending enough time. Because if you miss cleaning certain tooth surfaces, it doesn't matter what type of brush you have, those areas are not going to be clean.
So we may have already mentioned a few of these before, but the important things to remember is to avoid brushing too hard and to use a good brushing technique and avoid that forceful back and forth motion with your toothbrush. Also, you should be avoiding brushing your teeth straight after consuming something that's acidic or sugary, as this will temporarily soften the enamel of your teeth and therefore can lead to tooth wear. You should avoid brushing your teeth for at least 45 minutes after you have just eaten or drunk something. You should regularly replace your toothbrush or your oscillating head on your electric toothbrush, as these bristles will usually wear out around about the 3 months mark. If your toothbrush starts to look like this after a couple of weeks, you may be brushing too hard.
You might want to occasionally consider using a plaque disclosing tablet, which can help to test how well you've brushed your teeth. This tablet is a purple vegetable dye that helps to identify colorless dental plaque by staining it blue or purple. A great way of testing yourself is to use it just after you've finished brushing your teeth, as it stains all the tooth surfaces which still have dental plaque remaining on them. You can now go back over these surfaces until you have removed all of the dye. Next time, try to remember these particular areas and clean them thoroughly.
These tablets are relatively inexpensive and is a great tool to use initially. Once you start getting the hang of it, you're not likely to need them as often. It's understandable for you to think that this is just simply toothbrushing. However, you'll be surprised how these small changes can have a massive impact on your dental health over the years to come.
The way you use it is by placing the tablet inside your mouth. Don't swallow it. Chew and swirl it in your mouth as you would mouthwash until the tablets dissolve. Then spit out the excess foam, rinse with water lightly, and look in the mirror to reveal the results.
As my periodontal or gum professor used to say, you only need to floss the teeth you wish to keep. So make sure you're either using interdental brushes or dental floss once a day to clean all your teeth, even the ones at the back, which are much harder to do. Bristles on your toothbrush can't access these areas in between your teeth. So if you don't clean them separately, you're always going to be leaving food particles or dental plaque, which can lead to tooth decay and gum disease.
Interdental brushes are small color-coded brushes which come in a variety of different sizes. They are very effective at removing dental plaque and food particles in between your teeth, where the bristles of a toothbrush can't reach. The gaps between your teeth will vary in size, so you need to use the right sized interdental brush in order to clean each gap properly.
When the gaps between your teeth are so tight that the smallest interdental brush cannot fit, then this is when you should usually be using dental floss. When selecting an appropriate size interdental brush, it should have a snug fit in the gap between your teeth. It shouldn't be too tight or too loose, and you should never have to force it through a gap. Your hygienist or dentist should be able to guide you further. If you suffer from gum disease, it is essential that you learn how to maintain really good oral hygiene by using the correct size interdental brush for each space or gap.
Your gums will bleed when you first start flossing and we're using interdental brushes, so don't be alarmed if you see blood around your gums or in your saliva. This is to be expected initially. Your gums will be prone to bleeding due to the inflammation caused by dental plaque. This is covered more in the gum disease video. Your gums will need a relatively clean environment and sufficient time to heal to reduce the inflammation. Therefore, it's vital that you persevere and keep those areas clean despite seeing the blood. After a short period of time, you should notice your gums will bleed less. Combined with appropriate dental treatment, reduced or no bleeding gums can be a sign that your gums are improving in health. If you're a smoker, your gums will bleed less due to the nicotine in the cigarette. This can hide gum disease, but refer to the gum disease section for more information.
At first, your gums are going to be sore when you first start to clean them, and this is due to the inflammation around the gums. Think of it as when you first start working out, your muscles are going to be a bit sore. This is just a natural response and you shouldn't be worried about it. This will only be at the beginning when your gums are most inflamed. As the inflammation improves, so does the tenderness around the gums. Afterwards, you'll be able to floss or use interdental brushes completely pain-free.
At first, flossing or using interdental brushes can seem quite long and tedious. It can initially be difficult and could be hard to find the motivation. Nevertheless, if you persevere, you'll naturally become faster, more accurate, and better at it, meaning that you'll be able to clean your entire mouth in a fifth of the time it took when you first started.
So there are many different flossing techniques, but I'll just talk you through one of them. Take a decent sized length of floss, about 40 centimeters, and then wrap 2 loops around your left index finger, and then wrap the remaining amount of floss around your right index finger until you have about 5 centimeters in between your 2 fingers. Now use both of your thumbs to gently push the floss in between your teeth and then press it below the contact point where the 2 adjacent teeth meet. Don't push too hard or use a sawing back and forth action. Just a simple wipe up and down against both the sides of your teeth. Once you've cleaned one area, move to the next contact point. Make sure you use a fresh clean part of the floss for each new area. As the floss becomes used and dirty, unwrap more clean fresh floss from your right index finger and wrap up the used dirty floss with your left index finger so that you're still maintaining around about 5 centimeters of floss between your two fingers. Repeat this action and work your way around the entire mouth. If you keep at it, you will naturally become much quicker and efficient at this.
First of all, you want to select the appropriate sized brushes, and your dentist or hygienist can help to guide you with that. Insert the dental brush in the gap in between your teeth, just below the contact point where the two adjacent teeth meet. Press it against one side of the tooth so it curves around, and then move it in and out gently. Then press it against the other side of the tooth, and then again in and out. Once the gap is clean, remove the brush and wash it under running water. Repeat this process between the next two teeth. If the gap of the next two teeth is larger or smaller, then you should change the brush size accordingly. Some gaps will be so tight that even the smallest interdental brushes cannot fit in these areas, and so you need to use dental floss. Remember to change the brushes when the bristles become deformed or worn out.
A dental bridge is an artificial tooth which is attached to one or two natural teeth. There are different types of bridges. As these teeth are connected, regular dental floss cannot be used as you will not be able to push the floss under the contact points, so this is going to be a job for super floss. This is a special type of a floss designed to clean and maintain dental bridges. It is quite easy to get food and bacteria trapped under bridges, which can irritate the gums below, so it's important to have a way to clean under them.
The way you use super floss is by threading the super floss just below the point where the dental bridge attaches to the natural tooth. Then pull the floss through until the thick fluffy part of the floss is under the bridge. Slide the fluffy part along the underside of the bridge in a wiping motion. Once you reach the other side of the bridge, you just thread it all the way out. This should ideally be done once a day, preferably before bedtime, to prevent irritation of the gums and tooth decay.
After eating, you should ideally remove your dentures and rinse them under running water to clean away any food particles. You should regularly clean your dentures morning and nighttime using a soft bristled brush and a fragrance-free soap. Avoid using toothpaste as these are usually too abrasive for cleaning denture surfaces. It is very important to brush off all the food and bacteria which has built over the day. Make sure you're cleaning every surface of the denture, especially the surface that fits against your gums.
It's quite common for dentures to break by being dropped on a hard porcelain sink during cleaning. To safeguard against this, you may want to fill the bathroom sink with water and place a towel over it before cleaning your dentures. Also, you should always remove your dentures before going to sleep. It is best to store them overnight in water at room temperature. You should never be using boiling water as this can warp the shape of the dentures. Please don't use any type of bleaching products to clean your dentures as these will usually weaken or discolor the denture. It is important to visit your dentist at the advised recall period to check the fit of the denture and to examine and assess the health of your mouth. If any parts of the denture break or any metal cusps become bent, then please visit your dentist as soon as possible.
On the screen now, you're going to look at a prevention summary on how to maintain good oral health and to help reduce the risk of gum disease and tooth decay. We go into much greater detail on everything on this list in each of the videos in each of the dedicated sections on the My Dental Care app. Sometimes in order to make a change, you need to understand the processes and the reasons behind it. So in light of this, we do hope that you look and read it into each topic. However, on screen now is a concise summary of all the important prevention tips. So please feel free to pause the video and have a read.
So that's everything you need to know when it comes to maintaining good oral hygiene. We hope you found this video useful, and if you did, feel free to check out the other videos in the My Dental Care app or subscribe to our YouTube channel for more. Take care, and we'll see you in the next video.
Thanks for watching, guys.